Hello, everyone. Welcome to a very special edition of the Believe in Bingo podcast presented by FanDuel. I'm your host, Solomon Wilcots. And of course, in light of the news this week that former running back Chris Johnson has been diagnosed with ALS at the age of 39, we wanted to stop down and have a very important conversation to talk more about ALS, this dreaded disease, and what's being done to treat it. And for that, we welcome to our show a very special friend and a very special guest, Dr. Fred Grossman, Chief Medical Officer of Coya Therapeutics. Dr. Grossman, how you doing today?
I'm doing okay. Thanks for having me, Sully.
Well, look, we needed to have you because we have some very serious questions that we want to ask you, particularly as it pertains to ALS, also known as Lou Gehrig's disease. And I seen the recent news that former NFL running back Chris Johnson has been diagnosed with this disease without commenting on his personal situation. What does news like this mean for the broader ALS community?
This is very important because it validates the experience that people suffering with ALS has. It also allows for increased understanding that ALS is with us and it can affect anyone. And hopefully that can lead to more funding, more research to come up with a therapy. As you saw in that clip, Chris Johnson had a very effective career in the NFL. He was a superstar. And at the time of retirement, when a big part of his life was ahead of him, with support, with a great family, you see that in the span of a year, he can only communicate now with his eyes and a computer. He seemed immobile, and as he said, he can no longer lift his daughter. So this is important to get information out there so people are aware of this disease.
He also went on to say that he has a choice and he is choosing to fight this disease and really help with anything that we could do with finding some therapy to make life better for those who suffer from ALS and to keep others from developing or suffering from this dreaded disease. So for listeners who may not be familiar, help us to understand what is ALS and why is it such a devastating disease?
So ALS is a progressive degenerative disease. People become weak. They become paralyzed over time. The problem is that from the time of diagnosis, people diagnosed with ALS die within 2 to 5 years. It's a relentless progressive disease. A voluntary use of muscles stop over time. So you can imagine someone might initially have peripheral muscles such as leg muscles, limb muscles, arm muscles affected. They might notice some weakness in a hand, for example, maybe difficulty buttoning a shirt. And this progresses and it can affect any muscle in the body. So not only the muscles of movement and strength in the arms, but it also can affect vocal cords. So speech can be impaired and also swallowing. And you can imagine and see that over time, as this progresses, it can progress rapidly, as in the case of Eric Dane and Chris Johnson. Over the span of a year, they become immobilized, or a little bit slower. But people then have to become more dependent on family members, on healthcare givers, and on devices just to live. So people will need a wheelchair over time when they can no longer ambulate, maybe a feeding tube when they can no longer swallow, a computer because the eyes don't tend to get affected. So through the eyes, people can learn how to use a computer to communicate. Eventually, it affects the respiratory muscles and people die of respiratory failure. So it's a relentless disease for which there are no adequate treatments at this point to slow or stop this disease in a significant way.
Well, last week, I joined you in a webinar along with Lee Steinberg and Dr. Stanley Appeal to discuss the intersection of repetitive head trauma, brain inflammation, and neurodegenerative diseases. What do you remember? What were some of the biggest takeaways from that discussion?
I think the important points were that it's the subconcussive blows that cause this continued elevation in inflammation and destruction in various areas of the brain. I think that's one of the take-home messages. It's not just these spectacular blows that you see in a football game from a receiver going up for a ball and getting hit. It's these subconcussive blows that are happening on a chronic level. And it doesn't just start in the pros, it starts as a child when children join a soccer league and start to use their head, or as an adolescent when they join football leagues. The point is that this is an ongoing issue because with each subconcussive blow, you're affecting the brain, and inflammation is being caused, which can lead to these terrible diseases as an adult. And what's important in that webinar is to get information out there. It's not to stop sports. Sports is integral to the human race. It's to understand the risks as a family and to mitigate those risks. And I think Lee Steinberg went into some of those mitigation efforts that are taking place.
Yeah, Lee Steinberg was phenomenal. He comes with a lot of information and a very unique perspective as well. What does the research currently tell us about the relationship between repetitive head trauma and the risk of developing neurodegenerative diseases like ALS?
Well, let me start with a statistic
Mhm.
that's interesting. First, fortunately, ALS is still a relatively rare disease. However, in the general population, in one's lifetime, the likelihood of getting ALS is about 1 in 400.
Yeah.
In the military, it's about 1 in 200.
Mm.
In the NFL, it's 1 in 100. That's
Wow.
4 times the risk of developing ALS and other diseases compared to the general population.
Yeah.
So that's a harrowing statistic. So what does it tell us? It doesn't mean that repetitive head blows cause ALS, although it may, but we just don't know. It means that there's an association, so that it's possible that people who are predisposed to these diseases, perhaps during times of getting these subconcussive blows, it expresses itself perhaps earlier. So that's a harrowing statistic, and it points to the fact that there is a relationship between inflammation, head blows, and these neurodegenerative diseases.
Dr. Grossman, tell us about Koya Therapeutics and what is the company's approach to treating ALS?
Our goal at Koya is to come up with a therapy that allows people to live with ALS with a good quality of life. And the concept here is that we're in development with a biologic combination of 2 separate biologics together that we believe has the potential to halt or slow the progression. And that's important because we are trying to look at this disease in its entirety. We're not trying to cure it. We're trying to stop the progression, which means if we can get to people early and show that this therapy can stop or halt or slow the progression, that means people can live a good quality of life and have longer survival. So essentially, what we're trying to do is take a disease that's lethal over a short period of time and convert it into something a person can live with a good quality of life and long-term survival.
Yeah, Koya is currently advancing the All Stars clinical trial. Can you tell us what that study is evaluating and why it's so very important?
It is. So the concept and the mechanism here deals with reducing inflammation and creating a homeostatic balance. So what does that mean? our bodies have an immune system so that when there's a foreign invader, the immune system kicks up, inflammation increases to destroy that invader. But you can't maintain that state or you'll destroy your own body. So there are these cells that are called regulatory T cells that put the brakes on to create and maintain this homeostatic balance. So our therapy combines two biologics that increases the number of regulatory T cells in number and function, because in multiple diseases, such as ALS, frontotemporal dementia, regulatory T cells are impaired. They're lower in number and function. So what we try to do is recreate this balance so that these people who have this elevated inflammatory condition that's leading to these neurodegenerative disorders such as ALS can stop that progression. So right now we have a controlled trial called the All-Stars trial. It's a large trial with 2 treatment arms and a placebo group. This is being run right now, and patients are coming into this trial for the last several months. We're on target with our recruitment right now across 25 sites in the US and Canada. And this is essentially evaluating whether this therapy does what we think it will do, which is to halt or slow the progression in ALS. The study is a 6-month study with a 6-month extension. And after 6 months, the patients who are on placebo can then go on the therapy in a blinded manner. This is important. It's a blinded study. It's a controlled study. It's a powered study. So at the end of the day, those results will tell us whether this therapy can in fact work. And if it does, we're going to move very quickly towards potential approval.
Well, we can only hope and pray that it does, and we wish you all the best in your efforts to move the study forward and to find a treatment that could help so many lives and people who are suffering from ALS. What makes Coya's scientific approach different from other efforts underway in the field of trying to treat ALS?
Well, I like to call our mechanism a meat and potatoes mechanism.
Okay.
It's very clear to understand.
Mm-hmm.
It lowers inflammation and maintains the immune balance. It's as simple as that. We're agnostic to a whole variety of diseases because any disease where inflammation is a key component, this could potentially treat. And we'll have to study that moving forward. We're also going to be studying frontotemporal dementia. So to put in other terms, we're not going for the Hail Mary pass. There are many companies that are, and we hope that they continue. We're not looking to cure the disease, and we're not looking to reverse it. We're looking to get at patients when they're first diagnosed and influence the disease so they can live a productive life moving forward and a longer life at this point. So we are right now in the red zone, essentially. This study is critical. This will give us the answer. And the whole study and this concept is built upon the shoulders of giants. So on our scientific committee is Shimon Sakaguchi, who discovered regulatory T cells, and he won a Nobel Prize in Medicine last year for it. We have Dr. Stanley Appel that you mentioned, who spent decades discussing and studying the relationship between inflammation and these neurodegenerative diseases.
Really good work being done by some great scientists and great people like yourself, Dr. Grossman. So for listeners who want to learn more or are interested in participating in the All-Star clinical trial, where can they go to find out more information?
They can go to the website trials.coyatherapeutics.com, and that's trials.coyatherapeutics.com. And on that site, we talk a little bit about the disease, and we list all of the sites that are currently participating in the All-Star trial.
Well, we want to thank you for taking the time to join us, enlighten us. We wish Chris Johnson all the best and the support of he and his family. And we appreciate you, and we wish you all the best in the work that you're doing to find a treatment for this dreaded disease. We're going to take a break. We're going to come back and wrap it all up on this edition, a very special edition of the Believe in Bingo podcast. We'll be back with more. Welcome back to the Believe in Bingo podcast presented by FanDuel. Of course, I'm your host, Solomon Wilcox. We want to thank Dr. Fred Grossman of Koya Therapeutics for joining us on the show. It's now time to talk about the Cincinnati Bengals, because the Cincinnati Bengals are increasingly hunting to get better on, guess what, the offensive side of the ball. If there's one area where they feel they can improve upon on offense, and that is increasing the amount of explosive pass plays on offense. And guess what? By doing so, they want to put Joe Burrow under center. They believe this by putting him under center and having more play action pass opportunities, that it will increase their ability to create more explosive pass plays on offense. Now, what constitutes an explosive pass play? That's a pass completion of 20 yards or more. And they believe that with Joe Burrow operating under center, operating with the play fakes, and with play action pass, that it will help wide receivers to get greater separation down the field. Jamar Chase, T. Higgins can get even better, have better production. It also will help the offensive line when it comes to their run blocking and getting Chase Brown to the second level. Defenses have to be more alert when quarterbacks are aligned under center, and when quarterback has play action opportunities, what we call a play fake, sticking the ball in the belly of the running back and then pulling it out when they can't even see it. The defense can't see it. It's a sleight of hand move that the quarterback does, and then he comes up and he can throw it deep. Boomer Esiason was great at it in our Super Bowl run in 1988. It was one of the things that made him one of the best quarterbacks in the league. In fact, he won MVP that very same season. Well, I'm going to tell you, Cincinnati Bengals last year, they ranked 31st in number of plays with the quarterback under center. That is second to last. They ranked 30th in plays when the quarterback was under center and running play action passes. So they were near the bottom of the league in both categories, which means they ranked 22nd in explosive pass plays. Think about that. As good as the Cincinnati Bengals are on offense, they can become even better by putting Joe Burrow under center and running play action pass opportunities. I'm going to give you a number that should blow your mind. Think about this. If you take all the teams in the league combined, all 32 teams over the last 3 seasons, right? When they had the quarterback under center and they ran play action fake, they were able to create over 1,500 explosive pass completions of 20 yards or more when the quarterback was under center and they used play action. Among those 1,500 pass plays that went for 20 yards or more over the last 3 years, the Cincinnati Bengals contributed only one of those 1,500 plays of all 32 teams combined over the last 3 seasons. One. Think about that. If they could just put the quarterback under center, run more play action passes, they will be even better, as good as they've been. I can tell you this, over the last 3 seasons, the Bengals have not been to the playoffs. So you could say that maybe putting us under center, running more play action passes is going to help our passing game become even better. And it might even help us end our 3-year drought of missing the playoffs. Think about that. Cincinnati Bengals are going to run more quarterback under center, more play action opportunities to help improve what is already a really good offense. That's going to do it for this very special edition of the Believe in Bingo podcast presented by FanDuel. Thank you for joining me, everyone. We'll see you next time.